So we conducted a large trial in Europe in patients in first relapse or progression of aggressive B-cell lymphoma. The population are patients, elderly patients, which are not eligible for high-dose chemotherapy and autologous stem cell transplantation. Thus, this represents a population where it's an unmet medical need because these patients have a poor prognosis. So we tested a very common immuno-chemotherapy regimen, R-GemOx, so Rituximab, Gemcitabine, Oxaliplatin. It's widely used in this patient's population, and we compared it with R-GemOx plus Nivolumab, an immune checkpoint inhibitor, which was given over a period of 1 year. And we have performed an interim analysis. It was defined in the protocol for efficacy, and what we found is that there was no difference in the primary endpoint. It was progression-free survival after 1 year. So 1 year progression-free survival in both patients, in both trial arms, is identical, unfortunately. So the response rates are the same. However, there was a big trend for better survival for those patients who received Nivolumab. So those patients who have been treated in the experimental arm. And this was surprising for us, the finding. So if there's no difference in progression-free survival in response rate, but a better survival, it suggests that something after second progression is happening, is important. And we hypothesized that these patients' salvage therapy is more effective. And indeed, we analyzed these patients who received salvage therapy, follow-up therapy after protocol therapy. And in this patient's population, so this represents a subgroup of all patients, they have a significant better survival. It doesn't matter if you give just immuno-chemotherapy, CAR T-cell therapy, radiotherapy, these patients have a better survival. And so far we do not know exactly why. It might be that these patients are just fitter because of a fitter immune system after treatment with immune checkpoint inhibitors, or if these patients respond better to salvage therapy. This has to be figured out in the future. So actually the trial opens questions which we have to answer by translational research and follow-up research.